The struggles and shortfalls of the country's aged care sector have been laid bare in a new review into COVID-19 clusters in rest homes. More than half of New Zealand's COVID deaths have been in rest homes, with 5 of the 16 clusters at aged care facilities. The Ministry of Health review found the virus was brought into facilities by infected staff or visitors, and rest homes weren't familiar with concepts such as outbreaks, clusters, probable versus proven cases, and key terminology. The report comes as rest home nurses warn of a critical staffing shortage. There's currently about 300 vacancies for registered nurses at rest homes around the country. Those positions require the same qualifications and skills as nurses working for district health boards, but they're paid significantly less. Often those roles are filled by nurses from overseas, and with the borders now closed, rest homes say they don't know how they're going to find new staff without a decent pay increase. Our cameraman Nate McKinnon and reporter Nita Blake-Person filed this report.
Hi, Jill.
Hi, Stella.
How are ya?
Griselle Mosquera has just begun her shift at Christchurch's Chatswood Rest Home. She's a registered nurse here, and her patient Jill is one of 50 she will work with over this shift.
So I'm just gonna have to take a look at your legs.
Originally from the Philippines, Griselle began as a healthcare assistant here 4 years ago before getting her New Zealand nurse registration last year. She changes dressings, provides palliative care and medical assessments, everything you would expect in a hospital, but without the backup from other medical staff.
Majority of the time, we're the only clinicians here on the floor, so it's expected of us to make clinical decisions without really the support of other medical professionals on the floor.
Those challenges were especially evident over the past couple of months.
Our residents are the most frail and most vulnerable population of New Zealand, so we're we feel really protective of them because we don't want anyone to really, get unhealthy or get sick because of COVID. It's pretty tough every day, but we love taking care of our people here. No matter how tough or busy it is, even if you don't get a chance to sit down and take a break, well, at the end of the day, you've done your best, and we're grateful that we're here working for them.
And Jill says that care during lockdown didn't go unnoticed.
Everything that they did in hospital is what they're doing here.
More than half of New Zealand's COVID deaths were in rest homes, with 5 of the 16 clusters at aged care facilities. Staff at Chatswood worked hard to keep residents here safe, but Jill notes it can't have been easy.
Sometimes wonder if they're a wee bit short-staffed, and that makes it harder for them.
Rhonda Sheriff, the co-owner of the Chatswood Rest Home, puts that down to the significant difference in pay for rest home nurses compared to their DHB counterparts.
I think it's been really sad that we can't actually acknowledge these nurses because, by word, they have stepped up and done a phenomenal job. You know, they've been protective of our residents, they've been their family, as well as providing great levels of care. And, our families give such positive feedback all the time that it's such a shame that the general public don't seem to understand that.
Experienced DHB nurses can earn around $90,000. Here, nurses with that same experience would be lucky to get between $60,000 and $70,000. And with around half of all New Zealand's aged care nurses trained overseas, Rhonda says the border closures due to COVID are only going to add to staffing shortages.
Those nurses come in, as I say, they're usually sort of in their 20s and 30s. They start off, they've obviously had some experience where they've worked initially in the Philippines or India. They come, they increase their base level, and then they move off. We're reliant on our immigrant staff to come in because our New Zealand registered nurses aren't interested in working in aged care, unfortunately. Because of the fact we can't meet their wages as they earn in the hospitals, they don't want to take a pay cut and come and work in our area, even though they recognise that it's a highly skilled area for staff to work in.
She wants to see the government increase funding for aged care nurses to bring them in line with their DHB colleagues.
Operational costs are extremely high, as you can appreciate. Our wages bill probably sits somewhere between 60 and 65% of income, and then we've got to manage all of the other expenditure with what's left over. I can tell you, I do not make anything operationally out of this business. I mean, it will be a crisis. You know, I don't think it ever gets to the situation where it doesn't present its challenges, in the respect that we can't seem to attract our own New Zealand registered nurses, and yet we should be able to.
She says COVID has highlighted the incredible work that aged care nurses do, and Jill agrees.
I think they should be paid as the equal to the nurses, to be honest.
Chriselle says she likes to think of herself as a caring person, and it's the love for patients that drew her to the profession. But money talks, and she's definitely considered the pull of a DHB position.
Several times, yes, mainly because of the pay and the difference in the workload. Yeah, because I've got friends who worked in aged care are now in DHBs, and they can really see the difference.
And unless the government can step in with more cash, she says things are only going to get worse.
I mean, DHB is going to attract more nurses, and what's going to be left for the aged care? So there's going to be less nurses for taking care of the elderly, I think.
In Christchurch for Checkpoint, Cornita Blakeperson, Aho.
In a statement, the Ministry of Health says rest homes agree on a price with DHBs each year for the delivery of services, and they're responsible for wage costs. They say it's not appropriate for the Minister of Health or the Ministry to comment on the wage rates agreed between these private sector employers and their employees. And they also say that nurses and aged care workers are included in the list of essential workers able to enter New Zealand despite the border closures.